Thank you, gentlemen. 746, really important stuff to talk about right now. Pregnant women, listen up. A very scary and potentially deadly story. Our Fox 5 medical expert, Dr. Chaffoo, is here this morning to talk about the Zika virus. Dr. Chaffoo, good morning, and thank you for being here. We just started seeing this pop up all over the news over the past few days. The Zika virus now getting to the point that they're asking women in some parts of the world not to have babies at all until 2018. What is the Zika virus?
So Shally, the Zika virus is a virus that actually we can get that if we travel to places like Central South America, even to countries like Brazil, where it's actually found. There are about 3,000 cases where they found microcephaly, which was an abnormally small developed brain. The virus actually is transmitted by a mosquito. It can bite someone, and then unfortunately, oftentimes there are no symptoms in 80% of the people. The CDC has demonstrated that 20% of the people that get bit by the mosquito that develop the Zika virus will have symptoms, and those symptoms can be things like a headache, arthralgias, a small rash, but again, not enough to go to the doctor.
Okay, alarming for myself, and I'm sure some of our friends that are with child and pregnant. When I heard this, I'm like, oh dear, what does this mean? Because the latest that came out was that they're saying this could now spread into the United States.
Well, actually, there are cases now. There are reported cases, the CDC has said, in both in Florida, Illinois, and Texas, of people that have traveled to South America and then actually got bitten by the mosquito.
But
allegedly
it's over
they came over.
The mosquito's not exactly here in the U.S.
Correct, but the thing is, if someone has that virus and gets bitten by a mosquito, it could be passed from person to person. So although it's that particular mosquito, that mosquito can also be endemic to the United States. The only two places where the individual mosquito is not found is in Chile and Canada. However, a mosquito can act as a vector for that. So although we're not seeing cases of it now, transmission through to people, locally it can certainly happen.
So does that mean that if you're pregnant and you are exposed to, as someone around you has the Zika virus, that you can get it just being in the presence of that person?
Well, you have to get bitten by the mosquito.
Okay, so
obviously.
It has to be a mosquito.
Correct. Now, there are other ways to get this.
This is the mosquito, by the way?
This is the Aedes mosquito.
Okay.
Yes, and they're very aggressive. They bite all day long, so it's very easy to get this from this mosquito. And the problem is, as we said earlier on, that you won't have symptoms early on during the disease, and so 80% of people, women that are pregnant, will not even know they have any symptoms at all. The problem is, what the CDC is recommending to women, if you're pregnant, not to travel to those countries.
Yeah, some of those countries, let me see, I have them here, urging pregnant women not to go to Bolivia, Brazil, Colombia, Haiti, Venezuela, Puerto Rico, the list goes on and on. It's so new that the United States, I mean, here in the U.S., there isn't a vaccine for it, there isn't medicine for it.
And there isn't anywhere. There is no real vaccine or treatment anywhere. Exactly. The disease, the problem, Shally, is the disease is self-limited in adults, so we're unlikely to get any serious infection. The problem is for pregnant women that it can be passed through the placenta into an unborn baby, and they can develop microcephaly, which is a devastating congenital brain deformity where the brain development lacks the brain size of the skull. The brain development is smaller, so you can get problems like seizures, mental retardation, learning disabilities, small stature, really significant permanent neurological
And when you
problems.
don't have symptoms and you don't really know, we know that there's one case of a baby born with this believed to be linked to Zika in Hawaii.
In Hawaii.
Okay. So at this point, we have this information. We don't want to alarm and scare. I mean, I kind of got a little scared this morning. I'm like, what does this mean? Do I stay in the house for the rest of my pregnancy? Because it's scary thinking about that. What would you then recommend to women besides the not traveling?
Well, the important thing is if you end up going somewhere where this virus is located, which includes Mexico, Central and South America.
It includes Mexico because big travel seasons. I was even considering my travel plans this summer, and Mexico was one of them, and we changed it because of this.
Correct, and that's a good decision. So if you have to travel to those areas, then what the CDC is recommending is that you wear long sleeve clothing, that you wear insect repellent, that you keep your doors and windows closed, and that if you have any symptoms at all, a flu-like illness, then you would need to go see your doctor. There are tests that can be ordered, special advanced lab tests. If they're positive, if it shows that you have the virus, then women are offered an ultrasound. They want to look at the fetus and they want to see what's the brain development like. Is the brain small, and is there calcification? calcium in the brain. Those are 2 signs of microcephaly, and then you'd want to follow that patient obviously every 4 to 6 weeks with an ultrasound, offering the woman amniocentesis is another recommendation of the CDC to actually isolate the virus and determine that the baby was infected.
Well, Dr. Chaffoo, we appreciate you coming in and talking about this again. We saw the virus come up and you kind of read about it, but then when you really think about it, for especially women that are going to start traveling with families for the spring and summer, it's important information to know. Thank you for being here. 7:52, Chrissy, we'll get it over to you.